To answer your question, there's actually a lot of main advantages for minimally invasive foot surgery. One being minimal pain. We do the procedure through a very small incision, and so it protects the surrounding soft tissues like the nerves, the blood vessels, and the other soft tissues. So if we don't damage those during the procedure, there's less pain for the patient. The second big advantage is that there's less swelling. Coming back to what we discussed, we're not damaging the surrounding soft tissues or the blood vessels. So if we can protect that environment, there's less swelling for the patient. The third big advantage is that there's less of a scar, so it's aesthetically pleasing for the patient. So we live in an era now where everybody's trying to look their best, whether it's their face, their body, or even their feet. Nobody likes a big scar anymore. So we're able to actually minimize that scar. And to some degree, there is no scar because the incision is so small. So here at the Art of Foot Ankle, we make sure all of our patients are extremely comfortable. You are awake for the procedure, but rest assured you do not feel any pain during the procedure whatsoever. I utilize a local anesthetic, and it's kind of like going to a dentist for a filling. If you ever have had any dental work before, you sit in the chair, the dentist will numb the jaw and then do the work. I do something very similar, but for the foot. You come into the room, you sit into our comfortable chair, I numb the foot, and then you don't feel anything. You're hidden from the procedure altogether, but during that procedure, you're able to watch TV, you're able to be on your phone, and a lot of times the patients are having a great conversation with me. And again, during the procedure, they're not feeling any pain whatsoever. We give you a blanket, we give you a pillow so that you're extremely comfortable throughout the whole procedure. So as I mentioned before, we do everything through a small incision. So that eliminates infection rates. As a matter of fact, I've never had an infection with any of my surgeries because again, the incision size is so small. In traditional surgery, the incision is very big and it's open to the environment, and so there's a higher chance of infection setting into the foot. Other ways we keep our patients safe and comfortable during the procedure is that they're awake for the procedure. So I do a local anesthetic to numb the foot so they don't feel anything, but we keep them comfortable by utilizing a blanket for them, giving them a pillow. And then we have our friendly staff that's always in the room, making sure that they're comfortable, having a great conversation. We actually also give them some water. We give them some herbal tea as well, so they're comfortable during the whole procedure. We even have some patients that will actually be on FaceTime with their family members or friends during the procedure. They're laughing, they're having a good time. So we make it an experience for our patients. It's not, just surgery. It's an actual experience for the patient. Everything is nice and clean, everything's sterilized so that there's minimal to zero chance of an infection setting in for the patient. Other advantages that we can discuss is because the patient gets to walk the same day, that's also a big advantage. There's less chance of blood clot setting in. That is a big risk that patients take when they undergo traditional foot surgery, because oftentimes they're off their foot for 6 to 8 weeks and even sometimes 3 months. And so there's a high chance of a blood clot setting in. We talked about infection rates being very low with minimally invasive foot surgery, but also I utilize a technique where I don't even utilize any orthopedic pins, screws, plates, and so there's no need to come back for a second surgery to remove those implants, because sometimes with traditional surgery where implants are utilized, sometimes the patient will need to have them removed because it's causing irritation, or in some cases I've seen it where it's almost coming through the skin again.